Listen, hair loss sucks. It's not something that you can control, and although it doesn't have a direct impact on your health, it can really be a blow to your confidence, especially if it occurs in your late teens or early 20s. How's everyone doing? It's Isaac Wade, Doctor of Pharmacy, and in this video, we're going to be talking about the drug, which is the reason why I have my hair right now, because I started taking this drug early. This drug is called finasteride, and it's one of the most effective drugs for treating male pattern hair loss. In this video, we'll talk about how finasteride works. We'll talk about its history, how effective finasteride is, side effects, as well as some of my own personal opinions about this medication. But before we get started, I gotta tell you, listen, drugs are complicated. Everyone's situation is different, so make sure to speak with your healthcare provider before taking finasteride. That being said, let's get right into the video. Finasteride is what we call a 5-alpha reductase inhibitor, which prevents the conversion of testosterone to dihydrotestosterone. And these days in the scientific community, it's believed that dihydrotestosterone is the main cause of male pattern hair loss. But how did we discover this pathway? How did we figure out that dihydrotestosterone causes hair loss? Let's rewind the clocks a little bit. You see, back in the 1970s, scientist Julian Imperato McGinley of Cornell Medical College came across a group of Caribbean men that did not experience hair loss or enlarged prostate. When these men were examined more closely, however, it was observed that they did not have the hormone dihydrotestosterone, or DHT. Why was this? Why didn't these men have DHT? Well, it turns out that some small amount of testosterone is converted in your body to DHT, and the enzyme that facilitates this conversion is called 5-alpha reductase. These Caribbean men that had this beautiful, thick, dense hair, as well as small prostates, which is also very important, they did not have the enzyme 5-alpha reductase, and therefore, these men did not have the hormone DHT, and therefore, these men did not experience male pattern hair loss or enlarged prostate. When medical doctor and pharmaceutical executive at Merck, Pinderos Roy Vagelos, caught wind of this discovery, he saw an excellent business opportunity. He thought to himself, what if we created a drug that inhibited the 5-alpha reductase enzyme to lower DHT and to give men all over the world the benefit of having thick, luscious, bountiful hair as well as a small prostate? From there, a team at Merck, headed by chemist Gary Rosmanson as well as biologist Jerry Brooks, went on to create a drug that did exactly this, and this is what we know as finasteride. Finasteride, under the brand name Propecia, was finally approved at the 1 milligram dose for treating hair loss in 1997. Since then, finasteride has been given to millions of men all over the world, and in 2019, finasteride was the 86th most commonly prescribed medication in the USA with more than 8,000 prescriptions. Okay, so finasteride was approved by the FDA, but does it actually work? Let's get right into it. Just like any other FDA-approved pharmaceutical, finasteride was tested in a series of clinical trials. Finasteride was studied in mostly Caucasian men aged 18 to 41 with mild to moderate hair loss, and it was compared to a placebo sugar pill, and hair counts were taken over a 5-year period. As you can see in this graph here, researchers followed 4 different groups. The first group, denoted by a black triangle, was given finasteride for all 5 years. Notice improvements in hair counts over the first year, followed by a gradual decline into year 5, but even on year 5, you can see hair counts are still better than baseline. The second group, denoted by a black circle, was given finasteride for the first year, followed by a placebo in year 2, and then finasteride in years 3 through 5. Notice here an initial improvement in hair counts during the first year of finasteride, followed by a steep decline when men discontinued finasteride, and then a recovery when finasteride was resumed. A third group, denoted by a white triangle, was given the placebo for the first year, and then finasteride for years 2 through 5. Notice here an initial loss of hair, followed by improvements that continued into year 5, where men were essentially at baseline. And lastly, we had a group of men who were only given the placebo, never given finasteride. These men were denoted by a white circle. Notice here there is a decline in hair counts all the way through year 5, where these men were well below baseline and well below the finasteride group. So clearly, finasteride is effective for preventing progression of male pattern hair loss and providing some modest improvements as well. But as everyone always wants to know, is finasteride safe? Does it cause any side effects? Okay, so here is where things get controversial. Now, when I evaluate drug safety, any type of drug, right? We're talking about diabetes drugs, antidepressants, antibiotics, any type of drug I'm looking at, I evaluate safety by looking at differences in safety outcomes between the treatment group and the placebo group as observed in clinical trials. When it came to finasteride, listen here, we did see an increased rate of sexual side effects compared to the placebo group. Particularly, we saw a 0.5% increase in loss of libido and ejaculatory disorders. This is the equivalent to a surplus of 5 in 1,000 men. We also saw a 0.6% increase in erectile dysfunction. This is the equivalent to a surplus of 6 in 1,000 men. And lastly, we saw a 1.7% increase in men that experienced any kind of sexual side effect, right? Low libido, erectile dysfunction, premature ejaculation, anything like that. We saw a 1.7% increase in any kind of side effect, and this is equivalent to a surplus of 17 out of 1,000 men. It was also noted that most men that continued taking finasteride saw their side effects reversed, and all of men that discontinued finasteride also had their side effects reversed. Now, there were some issues that were reported once the drug was on the market and given to millions of men. Some of these issues included breast tenderness and enlargement, depression, hypersensitivity reactions like anaphylaxis, testicular pain, and male breast cancer. And these are the rare but potentially very serious side effects. There have also been reports of prolonged depression, prolonged brain fog, prolonged sexual dysfunction that continues after finasteride is discontinued. And this has been coined the post-finasteride syndrome. Now, I need to emphasize here, it has not been proven that finasteride causes these side effects. It hasn't been proven. It's possible that these men would have went on to develop these symptoms regardless of whether or not they took finasteride. For example, if I gave 10 million men a high five, some of them would have heart attacks. Some of them would have depression, some would commit suicide. Does this mean that my high fives caused heart attacks, depression, and suicides? Probably not. So to prove that a side effect is caused by a drug, we need to see it occur at instances higher than that of the general population, preferably in a placebo-controlled clinical trial, and we just have not observed this with finasteride. Another thing I want to note about side effects. Listen, almost all drugs can cause serious but rare side effects. Amoxicillin, which is the most common antibiotic that I dispense, and it's the 23rd most prescribed medication in the United States in 2019, amoxicillin can cause a severe skin reaction that requires treatment in a burn unit and often results in organ failure and death. In fact, I have a family friend who had to have a liver transplant after experiencing this type of serious skin reaction from amoxicillin. Does this mean we should stop prescribing amoxicillin? I think most people in the medical community would disagree. Amoxicillin has eradicated an unfathomable number of bacterial infections and is very well tolerated in most situations. And it's generally accepted that the benefits of amoxicillin outweigh the risks. Just like driving a car, flying a plane, or playing ice hockey, there is a certain amount of risk associated with each one of our behaviors. And it's up to you as an individual to decide whether or not the benefits of taking a particular medication outweighs the risk. And really, when it comes to complicated things like drugs, it's something that you need to talk to your healthcare provider about. Because at the end of the day, hair loss, this is a purely cosmetic condition. It doesn't matter if you go bald. From a health perspective, it might cause some psychological issues, but it's not really a necessary health concern, and it really doesn't need to be treated in a lot of cases. So if you don't care about your hair, there's no point of taking any drugs for your hair. So that's all I have to talk about today. Hair loss is a condition that caused me a lot of distress growing up, and I'm very thankful that I started taking finasteride early and was able to hang on to all of the hair that I have today. Before I end this video, I firstly want to apologize for the lack of uploads recently, and I also want to apologize for not answering comments. As I mentioned in a previous video, I find that comments stress me out, so I usually don't read them. But I like to leave the comment section open to give people that disagree with me an opportunity to voice their opinions. Anyways, thank you for watching the video, and I'll see you in the next one.